in rural and under-resourced areas. Together they are bringing health care, hope and healing communities in need. So it's really, really important that they are doing that, and I really can't wait to have a conversation with her. And as we continue our morning journey of awareness and well-being, we shift from the stories that heal the mind and the hands that heal the body. October is Breast Cancer Awareness Month, a time not only for education but to compassion in action, to put compassion in action, of course. And joining us this morning is Maureen Allem, founder of Skin Renewal, whose partnership with ILoveBoobies ensures that women, especially in forgotten communities, do get the necessary care in terms of early detection and life-saving care. Today we reflect on what it means to nurture both body and soul through medicine, empathy and mindful attention. Good morning, Dr. Maureen.
Morning, Kitty. Thank you for having me.
Thank you so much for making the time to be with us this very early Sunday morning. And I just really must commend you on the incredible work that you do, because, it's really incredible that you create this awareness in such areas where there's such a massive need for healthcare and awareness, especially when it comes to cancer in general, and then with breast cancer as well. It's really, really commendable, the work that you do in bringing this awareness. Thank you. Thank you so much for joining us.
Yeah, breast cancer is very close to my heart. So the more I can do, the better. And the more I can reach out to people and make them aware, the better.
Absolutely. Dr. Maureen, you often speak about the link between early detection and empowerment. How does awareness transform fear into hope?
Absolutely. If you're aware that there could be a problem with your breasts, especially after the age of 40, then you'll go for breast screenings. But the problem is lack of awareness that there is a problem, especially in the underprivileged community, lack of education as to how to examine your breast, your self-breast examination. And also accessibility to screening remains a key to saving lives. And despite the availability of sponsored screening programs, which there should be many more of them, 50 to 57% of women who present at the clinics are diagnosed with late-stage breast cancer, which is not great, because Black women are disproportionately affected by advanced stage disease, and this is because lack of awareness, lack of diagnosis, lack of referral to tertiary clinics. And if you're diagnosed earlier, you can change the survival rate from 40% for late diagnosis and survival to over 90%.
What?
So it's vital that, there's a huge difference if you diagnose breast cancer early and, aware of that you can get breast cancer. And the problem, look, it's great that October is Breast Cancer Month, but it's not only October that you need to screen. You need to screen monthly. You need to do monthly clinical, breast examinations. You need to be taught by registered nurses in the clinics to be able to do, self-examination. And unfortunately, most of the registered nurses in the health clinics haven't been properly trained. I think there are 400,000 of these nurses, and only 1% have had adequate training in self-breast, breast diagnosis.
It's really, really, it's absolutely crazy that, the difference in numbers from 40% to 90%. Wow.
Yes, if you get late stage, there's so many more treatments you have to do. It's so more invasive, and your prognosis is dropped dramatically. So it's vital that we get the message out, and not only in October, which is great, to be, start awareness, but all through the year. So it's a lot of work to be done to get this awareness education out there, and what to look for, to suspect that you might have a problem, and, refer to a clinic and make sure that the clinics know what they're doing when they actually do the clinical breast examination, because that's part of that whole global, the World Health Organization's Global Breast Cancer Initiative. And unfortunately, that mammograms aren't standard of care, in South Africa. It's only, so it boils down to early diagnosis by clinical examination, and, that's the kind of screening, and then referral to a center. But very often there's a delay in referral to the centers as well. So it just, adds on, the prognosis drops every time you delay. And sometimes it's months that they actually get so that's one of the things. Another big restraint is, the affordability. If you had to do a mammogram, it costs about 2,000 Rand, and how many people have 2,000 Rand to throw around? And
absolutely.
I mean that, and even just getting to a tertiary hospital or a clinic sometimes costs, these underprivileged people who are working on a minimum wage between 4 and 15% of their weekly wage. So it's just almost impossible. And then we have healthcare system failures because the registered nurses aren't properly trained. You need to know exactly how to do a breast evaluation. And there's a great YouTube thing. It's called Pumeza, which you can go on, and it's a quick 3 minutes.
Yes.
It just gives basics explaining how to do a breast examination, where you use your 3 fingers, not the pads, the 4 fingers, and you go in circles around your breast, around your nipple, around your, the pink part of your breast, under your arms, up to your clavicles. So much can be done. And there's quite a high detection rate, when you do, monthly breast examinations. And that should be done like a week or 10 days after your period. That's when you lie down you first stand in the mirror, look at what's going on, see if there's any funny, orange peel effect, press on your nipples to see if there's a discharge. So there's so many screening things that the women can do themselves, but it's just a matter of education and awareness. And then if you find a lump, immediately go to a clinic who will then refer you to, for a mammogram.
My word, I'm sitting here and I'm listening to you and I'm realizing, I just know artificial information, in terms of how to self-test. You just most of us will probably just pat our breasts and feel nothing. But as you say, it's such a wide area. It goes all the way under your armpits to the clavicle.
Yes, the clavicle.
I wouldn't have known that. Yeah, I wouldn't have known that, because you know about the lymph nodes around your neck area and stuff like that. But I wouldn't have known that at all. So there can never be enough awareness,
Absolutely. And not about keep repeating ourselves. And even in our branches where we put out our ILoveBoobies boxes and we collect these gently worn bras, I was thinking we actually need to be to remind our women. Most of our patients are women, and that's why it's so dear to my heart, because when women are involved, you get empowerment, and women try to lift up, uplift other women. So it's important, year-long awareness.
Yeah, absolutely. Maureen, we're going to take a quick break and then we're going to continue with our conversation about early detection. And we are talking to Dr. Maureen from ILoveBoobies, and she is a founder of Skin Renewal, whose partnership with ILoveBoobies ensures that women, especially in forgotten communities, have access to early detection and life-saving care. Today, they reflect on what it means to nurture women in terms of making sure that they get the necessary care. We'll be back in just a moment right here on Channel Africa.
Let the good times roll.
From the 10th of October,
Make a note.
Channel Africa is stepping into a brand new era with the launch of our upgraded website and app.
It's easy, fresh,
and always on your fingertips.
wherever you are in the world. Africa's voice is just a click away.
The future of Channel Africa.
Okay.
Goes live from the 10th of October.
Don't miss the moments.
Hi there. Do you want to elevate your business and give it a voice in South Africa and Africa as a whole? Well, in that case, let Channel Africa make this a possibility. Channel Africa is willing to advertise your business for as little as 30,000 rands or $1,719.18. To get access to these great rates, send all requests to mukwenata@SABC. That's MOKOENATA@SABC. Channel Africa, the African perspective.
Mix Vibration sur Channel Africa.
Qu'est-ce qui vous a amené à dire ça? Est-ce que vous avez observé un certain nombre d'événements dans la vie? Est-ce que c'était par rapport à une expérience? Est-ce que vous avez rencontré des choses qui vous ont dit il faut de la patience, comme ça les choses vont venir au bon moment et les bons dieux pourra peut-être me visiter?
Oui, c'était justement un conseil que le Seigneur m'avait inspiré pour donner à son peuple, parce qu'il y a la plupart des gens, pendant que Dieu bénit les autres, ils pensent que Dieu les a oubliés, et pendant que Dieu ouvre pour les autres, ils pensent que peut-être Dieu n'a pas pu écouter leurs prières. Alors ce n'est pas le cas. Alors Dieu bénit tout un chacun de nous avec son temps. Donc le temps de Dieu est toujours le meilleur dans la vie de tout un chacun de nous.
Mix Vibration tous les dimanches de 18h à 19h, temps universel.
Weekends just got better. Only on Channel Africa. From 6 till 9 a.m. Central African Time. On Channel Africa. The African perspective.
And we are back with you right here on Channel Africa on the Oasis, exactly just after 22, the top of the hour, right here on the Oasis with me, Kitty Phethla, standing in for Nzago. And we're chatting to Dr. Maureen Allem, founder of Skin Renewal, whose partnership with ILoveBoobies ensures that women, especially in forgotten communities, have access to early detection and life-saving care. Now, Dr. Maureen, I wanted to find out from you, many women avoid screenings out of anxiety or cultural discomfort. How can we bring emotional and mental safety into the medical experience?
Yeah, there are a lot of profound social cultural factors where there's a stigma attached to, especially in the rural communities. More educated women understand the risks and come for their screening, but the underprivileged woman, there's that stigma where if you have breast cancer, it means, and if you have to go for surgery, you actually take your womanhood away. And also, very often women know that this could, if you find a lump, you could lose your life. So rather, not examine and rather not find out whether they have the breast cancer. But they don't realize the ramifications if they just leave it, if they leave the lump. And they've also, they're the mothers of the family, and they rather put the families before themselves, because when you do get diagnosed with breast cancer, it's quite a long journey that you have to follow, and then your family suffers. So, it's the cultural factors are huge. And I'm not quite sure. It's just education, I think, Kitty,
Yeah.
The more you educate people, to understand that if you leave it, your children won't have a mother,
Yeah.
that you go early, and if you find something, go to the clinic and let them refer you.
Yeah.
It's all about education and awareness.
And also that fear, man, people just carry so much anxiety, honestly, about the actual seriousness of it, You bring both compassion and clinical precision into your work. How do you balance the science of medicine with the art of human connection?
That's what it's all about. It's not just doing treatments and making people look better. It's making women feel better,
right,
and looking at health. That's the most important thing. When it comes to breast cancer as well, that lots of the African women also have very dense breasts, and women, even women in the upper socioeconomic status don't realize that you have to. If you have dense breasts, you actually have to go further and not only do a mammogram if you are privileged enough to have a mammogram, but you need to do, an additional treatment like an ultrasound or MRI, because a mammogram, if you've got very dense breasts, it's looking for a white cat or a polar bear in a snowstorm. Because what the mammogram picks up are these tiny little white calcifications. So there's another thing to make women more aware that if you do have very dense breasts, which African women do have, I think 40% over the age of 40 have very dense breasts, you need to do more than just, the mammogram. There's also, additional screening that needs to be done. And this has to be, go through education to all socio-economic groups,
Wow.
and very often it's all lifestyle factors that cause dense breasts. So, getting back, that's what we do at Skin Renewal. It's not only about injectables and in-clinic treatments.
Yes.
It starts with lifestyle and how we evaluate your lifestyle to see where you're going wrong, because there are pillars of health, sleep being the one pillar. And, I think there was a study done that 30% or 27% of the black rural women who are overweight have a problem called sleep apnea. They don't even know it. And that causes, blood pressure problems, insulin, sugar problems, and then, leading to what we know as, just unhealthy lifestyles that lead to these dense breasts. Wow. So if you can be aware of that, that's another whole thing, health education, getting to the root cause of disease, not only detecting it, but actually preventing it in the first place. So that's what we're all about.
Sure, I'm learning so much. My gosh, I'm learning so much. I didn't even know anything about, the dense breasts with the mammogram that you'd need to go for extra tests. Wow.
You're an educated person and you don't even know. I mean,
wow.
One of my patients, she came and every year she's been going for a mammogram. She's actually one of my longest patients for 25 years, so it's actually very close to my heart. And she'd go for a mammogram and all good. And then like a week before her next annual biannual mammogram, she felt a lump under her arm. And then she actually realized she had, I think, so 3 and 4. So you look for a letter A, B, you're okay, you got mostly fatty tissue. C and D, you've got breasts. D, you've got very dense breasts. And E actually is that they cannot see anything, and you've got a very high risk, to develop breast cancer. So that's very important. All socioeconomic things need to know what their status is. How dense are my breasts? You have to actually get the report and ask your radiologist, because that also makes a difference of life and death. Because the patient, by the time they actually did eventually did the mammogram, she was stage 4. Which is crazy, because she was going for mammograms, when she, like every year, I think. So you should, if from the age of 40, from the age of 40 to 75, you should go every second year up until the age of 74. But then it depends on your risk factors. If you have a family history of breast cancer, then you've got a higher risk. And sometimes you can even get breast cancer at 30. I've got 2 patients very close to my heart as well who were diagnosed. The one was diagnosed at 30, but she had the type 5, the really very dense breasts. And she developed breast cancer at the age of 30 and another one at the age of 31. So don't think that because you're young that you are, that it won't affect you. You have to do your breast clinical examination. You have to, and then if you have a problem, go and get help. Go for referral so that you don't have a late onset diagnosis, which changes your prognostic, 5-year survival dramatically.
Wow, this is scary, but so important, it's that anxiety you talk about, but it's so important because it can be life-changing if it's detected early. How do partnerships like the one with ILoveBoobies demonstrate that healing is a collective act, not an isolated one?
Absolutely. So we do our little bit. We, from August, we start putting our boxes out where we, so people can become aware. Patients, most of our patients are women. When they come in, they see the pink box. They see that you can donate gently worn bras. And then we have these ILoveBoobies socks. So for every 5 socks sold, it pays for one a free breast screening. like a mammogram.
Okay.
So it's very important, you know. So they also need funding, and that's what helps. You know, it's all very well to get the, you know, the gently worn bras, and every person that comes for a screening can get a bra, because very often it's also very expensive to have bras. And then they also get these ILoveBoobies socks, which is a reminder that every month you got to do breast screening. You know, 10 days after period, you got to examine your breasts and see what's going on, and eventually you will understand what your breasts feel like, and then you can pick up a lump. Okay, so it's very important. And they approached us because we had another social initiative project, which was Kamani, which was for period poverty, and that ran for 2 or 3 or 4 years. And then ILoveBoobies approached us, you know, because we have got a national footprint, and we've got these 20 branches all over the country where women can come in, buy the socks, you know, bring their bras. And it just makes, you know, the staff are also very motivated, because it is, you know, a women issue, and, you know, to help women. And they, you know, like I was in the one branch yesterday, and I said, "Where are all your socks?" They said, "No, they're sold out."
Oh, wow. That
So
is
it's incredible what they do, the staff.
Yes, yes.
It empowers women, you know,
Yeah.
and it empowers you to know that you're doing something about this very important problem and very high prevalence, you know, breast cancer.
Now, breast cancer doesn't only affect the body, it impacts mental health, family dynamics, and spirituality. How can holistic care address all of these layers?
You know, that's where you get these counselors. So very often some of these foundations, these NGOs, like the, you know, Pink Drive and the not so much ILoveBoobies, they have these volunteers. And ILoveBoobies does have volunteers. They've got 200 volunteers all over the world who you could contact and get. And these volunteers very often are breast cancer survivors. There's another one, you know, with Dr. Ben, who works with, there's another incredible initiative which was sponsored by a big farmer, one of the big farmers, but it only carried on that, you know, it was like a trial that they did in, I think it was, there's a clinic outside Pretoria where they screened 1,600 patients, or people, you know, disadvantaged people, and they compared it to ultrasound, because now with AI, there's an ultrasound. So what this doctor, she's got a PhD in imaging. Right. So what she's developed over the last 20 years is an AI for breast screening. Wow. And she's got 50,000 cases of breast cancer diagnosis in her AI. And so all you got to do is train on how to, you know, to manipulate this tiny little ultrasound machine, which is incredible. And it can pick up, and it's got very high sensitivity to pick up breast cancer. Then you can refer. So she's also part of these. So she's part with Carol Ben, where she does free breast screenings, and then she's also got these clinics. Not quite sure if you've heard of them. Unjani. Have you heard of Unjani?
Unjani.
Yes.
No.
Now this is another. This is not. You know, so it's not a non-profit organization. It's where they've empowered these registered nurses to own the clinics in these very rural areas, and they are, I think, they're sponsored as well. And then they offer, you know, these breast. They actually can do these breast ultrasounds with this Clarius ultrasound machine, which is wireless. So you can do it wireless, and then when you get to you can do it without, Wi-Fi. And then when you get to a place with Wi-Fi, you can download all the results, and then you can see. So it's quite incredible. So they've grown from 1 to 54 around, but they're hoping to reach like 1,000 of these around the country. But they need partnerships, you know. They need people to help partner with them and, you know, sponsor them to actually do all this good work.
Actually, this brings me to my next question. You know, in terms of help, hand in help. You know, how can ordinary listeners play a role in saving lives, whether through funding, volunteering, or emotional support?
All three. Okay, so if you want to volunteer, you join one of these, these breast screening places, like the one which was with Carol Ben,
clinics. ILoveBoobies. Okay.
Yes, ILoveBoobies, cancer, Pink Drive. I was driving back yesterday, and now I'm so aware of breast cancer, and I'm not sure if you've noticed these trees wrapped in ribbons.
Yes, yeah. I have.
Another breast cancer awareness drive that they're doing. It's another company that does that. So there are, many companies out there that are trying to, to create awareness and to do the screening, because that's the only way. You cannot go get a mammogram if you're disadvantaged and you can't afford a mammogram. So that's the only way. So you need to do it properly, and you need to have proper referrals and proper follow-up. And then so these volunteers, very often they are breast cancer survivors, and they really are amazing at what they do, helping, guiding patients through this emotional time.
Now, so, with you help so many people. As a doctor, a healer, how do you personally care for your own mental health and spiritual well-being while holding a space for others who are in pain?
Sure. It's difficult. You have to, it is what it is, and you have to. So, you have to de-stress somehow, and what you have to do is kick in your parasympathetic nervous system. So if you can just do 15 minutes a day of, like the Tibetan monks do the humming, that's been going for thousands of years. That is kicking in your parasympathetic nervous system, which calms down your fight or flight, the sympathetic nervous system. So that's one way. You can do the deep block breathing, just 15 minutes a day. So what I tell my patients is, when you're driving in the car, so people don't think you're mad, you can sit there and go, and do that for as long as you can. And just make, if you don't make time for health, you're making time for disease, and it's far more strenuous and thing to actually go down this path of breast cancer. So it's all about stress as well, Kitty. Stress causes so many things.
But that's the thing. People don't know that they are stressed, but the body knows. The mind knows, and it translates it to the body. So, it's such a thing that we can't detect, because I know myself. I don't know when I'm stressed, but the mind is so incredible. But it knows when you're stressed, and then it translates it to the body. It's also knowing yourself very well regarding the stress.
We get anxiety attacks, and then obviously if you've got money, you can go do blood tests and check what's going on and see what your cortisol levels are, because what happens, breast cancer and dense breasts, it's all about estrogen dominance. So lifestyle and nutrition play a huge part, because everything the water we drink, especially if you live in a municipal area, it's full of estrogen. They're called xenoestrogens.
Oh, wow.
Because all the HRT and all the oral contraceptives that we take go through our urine and land up at these water purification systems, and they cannot take the estrogen out, because even the fish are becoming, the male fish are becoming, feminized because of all the estrogen in the water.
Sure.
And so that's one thing. So you need to watch what you're eating, all the perfumes. When I drive in a car and I see those, those air fresheners, that's you breathing in those estrogens. Those, they're called POPs, these persistent organic pollutants. Even that is causing estrogen dominance.
Sure. This was so insightful for me. Like, literally, my brain is like, because I like to pride myself in being a student first before anything else, and I've learned so much. And it's so funny here. There is so much awareness, but what I take my hat off to you for is creating this awareness in all these forgotten communities in these rural areas, and taking that step forward to go and seek for help, and knowing what's going on with yourself and being in tune with yourself in a healthy manner, so, and I'm so grateful that you're creating these awarenesses as well, Dr. Maureen, because we can never have enough of it, because I mean, as I said, I'm a woman who lives in the burbs, and I haven't even gone for a screening.
All of it.
Yeah. We know of it, we read about it, but then it's just taking that further step as well. And I'm sure even my peers as women, we are too scared to do that, but we need to do it. And you have just literally blown my mind today in terms of how serious this is. And I'm so grateful that you care for other people and you're so sympathetic, and there's a spiritual awareness, and you give people a hug by just caring for them with your knowledge as well. So I'm so grateful for you for taking the time to chat to us.
Thank you. You've made my day. Thank you. And if I see one patient, I'm only reaching one patient. But when I go on our social media platforms, we can reach with our Facebook up to 700,000 people. But people have to spread the word. Not everybody's got access to Wi-Fi and all these fancy platforms. Yes. So it's about women educating other women. If you hear something, educate the other woman, share it, share it with someone you love.
Absolutely.
Spread the love, spread the awareness.
Yeah, thank you so much, Dr. Maureen.
Lives.
Okay, yes,
thanks.
absolutely. We need to spread that even more. Thank you so much.
Thanks so much. Okay, take care.
Take care. That was Dr. Maureen. That was Dr. Maureen Allem, founder and of Skin Renewal, whose partnership with ILoveBoobies ensures that women, especially in forgotten communities, rural areas, have access to early detection and life-saving care when it comes to breast cancer. Man, I'm so sorry we're late for the news, but we're going to go straight to the news with Matapelo Mohapi.
SABC News.